we've got to talk about an age of
Yeah, yeah.
legally.
See, I'm an old man. I'm thinking of my adult children. Thank you.
You know, I mean, because there are times where a child, 16 or 17, may be the oldest child.
Maybe. And they probably wouldn't be your surrogate.
Right. But what is the proper age for a surrogate?
Or
in terms
for surrogate.
For surrogate.
18 or older.
Okay, it has to be. Okay.
Yeah. And for a witness, 18 or older. But I may not choose my 18-year-old. I might choose my brother, my sister, my mom or dad, my cousin, my next door neighbor, my pastor, my friend.
Okay.
But somebody who will follow my wishes. And somebody who understands, not necessarily a nurse or a doctor or an attorney, but someone who understands enough of the mechanics of that who will follow my wishes. And the hospital will work with them during that time. Here's an ICU nurse. She works with us all the time. Hospital will work with them, making decisions, helping clarify things so that they're not going, oh, I'm all by myself. What do I do here? Advanced directive filing. Where do you put this thing? Not in your safety deposit box. No, not in the vault somewhere. Not in your lock box at home. But you may put it in a file and say, kids, family, if something happens, here's a file here. Here's my last will and testament. Here's my power of attorney for banking. Here's my advance directives, what I want about life support. Here's what to do. Here's where I want so-and-so to take care of the kids, so-and-so to take care of the dog and the cat. Here's everything taken care of I can think of so that if something happens to me, you'll know where the money is, how I do the bills, all these kind of things. Talk about these things. It happens, folks. It happens every day. We had a nurse in my hospital, 37 years old, was at an advanced directive seminar, collapsed with a brain aneurysm, taken to the ER, taken to the ICU. Her advanced directive said to donate her organs. Family donated her organs, and she was passed away. 37 years old. I don't know when it's going to happen. So we just simply get ready for that in the future. I would give a copy to my surrogates. My wife and my daughter has one of mine. I'd give it to the rest of my family if they need to know about that, adult children, those adult family members. A copy to my physician or physicians, those that take care of me, my cardiologist, my pulmonologist, my family physician, whoever takes care of me normally all the time, they should have all of those. Let's talk about nutrition, I guess.
When you're talking about a surrogate, though, sometimes it is easier on the family to have somebody that's outside of the family
Can
to
be.
make that final decision.
Because they don't want
I mean,
to
it might just be one of the in-laws. It might be somebody that's married into the family. It may be even the minister that knows the family well and knows, you know, because it's very difficult for someone to say that's in that family, yeah, I know this is Mama's wishes, but I don't want to take her off. You know, that to make that decision and be able to tell the whole position, this is the time. Mama didn't want anything else. I know. But so sometimes I found working with families that it's easier to tell them to pick somebody else. Like when it was my mother-in-law, she came to me and says, none of my kids will follow my wishes. I know that. Yeah. When it's time to unplug me, you're going to have to make the decision.
Yep.
And she put it right. I said, I will. I will do what's right for you and what's right for the rest of the family. And the rest of the family, when it came to that, they were so glad it was me and not them. And so I think that sometimes we can dump that on a family member, and they, at the time, then they don't want to follow Mama's wishes.
Probably can't do it. You get that ICU nurse the same way, you see that a lot. Yes, sir.
I just have a question as far as a volunteer chaplain. Yeah. If you get into a conversation with somebody about this and they don't have anybody, and you become that person.
As the surrogate?
Yeah, or just the person that they kind of build the bond with. Yeah. They have nobody else really close or anybody else that they trust. How careful do you have to be legally and personally about taking that step?
State of Georgia laws say that no hospital employee may be a surrogate or a witness, but you're not an employee, as a volunteer. But I would stay away from that since you're still connected with the system. I mean, if they absolutely had nobody, no pastor, nobody, and you're going, you are my only friend on this planet, okay. If you plan to be available so that they can get a hold of you, because on that surrogate card you may need to put phone number or address, whatever like that to get a hold. But There's a lot of people that are lonely that day. They don't have anyone.
I was going to ask, since you said these are available here, would it be possible for us to get a copy up here?
I meant to ask for that. Can we get
Just to see what
a
it
copy
looks like?
for everyone today? See one of those? Thank you. I meant to ask for that this morning and forgot. Thank you. No one, because let's talk about nutrition and hydration. Heroics feeding. I'm not talking about someone feeding you by the bed by the food tray. Okay? I'm not even talking about parade food. I'm not talking about, you know, liquid food. I'm talking about heroic feeding like TPN, food that comes through the IV, the NG tube, food going down the nose, down into the stomach, or the PEG tube, the surgery through the stomach, that type of heroic feeding. No one is going to let you starve to death. Okay, but you can ask, you can put that on your advanced directives, what you want about no nutrition, no hydration, which is going to happen when you have a poor prognosis, probably not terminal, probably more like end stage or persistent vegetative state or brain dead, where you're not going to feel the pain. Okay? Nobody's going to let you starve to death. There's a few patients that are terminal that say, take me off this ventilator. They write it, they can verbalize somewhere, take me off this ventilator, take me off this nutrition. I don't want to live this way, and let me go, and that's legal. That's not suicide. But most of the time, we're talking about making a decision for a patient that has not the capacity to make a decision. So we're not going to let anybody, everybody's afraid, oh, you're going to let me starve to death? I'm afraid to check the box. Do you have a point? No. This hospice says that in this natural state of dying, when the body is actually dying and letting go, there aren't the natural hunger pains that you and I have. So you're kind of looking at mama going, well, are we going to feed mama? Well, mama's not hungry. She's been in the bed like this for this long. Her system is shutting down. You're hungry. She's not hungry. Okay? So we wouldn't let a patient starve. So don't worry about in your advanced directive, we're going to starve. Who can witness someone over the age of 18? Not the surrogate. In your state, I put it because like Florida allows one blood relative, so all kind of states are different. In your state, no blood relatives should witness, and no hospital staff should witness. If there is no documented advanced directive, meaning no one wrote anything down, there is nothing verbal, we'd have no clue what this patient wants, that your list, and your state did not say it this clearly in the Georgia.gov last night, and maybe you can help me, and I see you nurse, you do this a lot. Probably guardian, state-appointed guardian might be first. A legal spouse. In your state, is there a common law marriage allowable?
No longer.
Yes.
Yes or no?
It's no longer a
No longer.
It's no longer.
Okay.
It was.
So then yeah, they would have to be the legal spouse. They cannot be the person who's lived with them for 20 years, who may know them best. But according to the law, that person is not the legal spouse. Now, if this common law type spouse is named surrogate, we're free, okay? If somebody's named them surrogate, their best buddy, we're okay. That's why we go fill out the paper. But if nobody's named, we're going down this list. Is there a guardian? No. Is there a legal spouse? No. Is there a real spouse? Yes. Or no. Majority of children. Maybe there's 3. So the 2 out of 3 get to make the deal, you know? There's tangles with that where the ethics committee can come help them. Do they have parents? Let's say they don't have any parents, they don't have any siblings, they don't have any relatives. Maybe there's a close friend. Allow this close friend to make that decision if they want to. Any of these can say, yes, I'm the parent, I will not make the decision. Go to the next. You know, yes, I'm a sibling, not me. Go to the next. So then, down at the bottom, Florida does this. I don't know if your state does this or not. We've had a lot of indigent patients in the hospital. No family, no friend, no nobody, and they're on life support, and we have to pay the bill, keep them on life support until they die, and that may not happen for months. And so now we can call in a social worker. We can't pay them. They work for another institution. They sit with our ethics committee and determine this would be the best thing for this patient to take them off life support. I don't know that your state has that. It may not have that yet. Surrogate's job is to do what the patient wanted. So many times in the hospital, we ask the wrong question. I'm not only a chaplain at my hospital, I'm the patient advocate. Some hospitals call it patient representative. And I sit with the